In previous history of tuberculosis, whether they will get fertility or not, many people having doubts. If there is any history of tuberculosis, see, usually tuberculosis will affect many parts in the body, mainly the lungs and then the abdomen and then the skin and then the lymph glands, and all these will be affected. And suppose if the reproductive system also gets affected. Whenever the reproductive system affects, it affects the uterus, if it affects the tubes, it affects the ovaries and every part, and in the abdomen and all over the surrounding structures of the reproductive system. So, whenever we come to know that the reproductive system is affected by the tuberculosis, and then we have to give the treatment for 9 months period, that is the with anti-tuberculous drugs and with giving very good food and all, and we can treat the tuberculosis. And sometimes the inside layer of the endometrium, like that is uterus, that is endometrium cavity, endometrium will be getting affected. Sometimes the Asherman syndrome, all the tissues, like so much formation of the foreign body tissue and the infective tissues, and then it gets many people will not even get the periods also. If really they are getting period, it is very good. If they are getting a scanty period, little bit enhancement of the period we will do, and we will do the reproductive procedures, ART procedures, and we try to give the good result. And if the uterus is having any problem, usually it will be reduced, it will be improved by giving anti-tuberculous drugs, and but the tubes will be already damaged, means the tubes are very sensitive structures, and after the damage again they will not come to a normal stage. So, the tubes will be suppose it depends upon the tubal problem. Actually, sometimes the tubes will become very tortuous, very thick walled, and inside all flagella and cilia will be spoiled, and sometimes the fimbrial ends will be spoiled. So, that what we will do, sometimes hydrosalpinx may occur, pyosalpinx may occur. So, we do not want the tubes, immediately we will clamp the tubes, and we will sometimes we may do salpingectomy also. And then the uterus, we will clear the uterus, we will clean the uterus, and we will give certain anti-tuberculous drugs, and all the vitamins and everything will pour, and we will try to improve the patient's capacity, childbearing capacity also we will improve, and we do the histoscopy, and we do the endometrial biopsy, and we send the endometrial biopsy to the histopathological examination, and we will come to know about the organism, like which organism is affected, which organism is there, and accordingly we will try to give the drugs. And then many of my patients have got pregnancy, and they have got babies also, even they are suffered with the tuberculosis problem and with that infection, and we treat them very properly, and then afterwards we will we have done so many ART procedures, and all our patients have got pregnancies. Suppose if the patient is having Asherman syndrome, like totally blocked, and the bleeding is not there, even though we give some drugs, the bleeding is not there, then it is waste. We have to advise them to go for surrogacy procedure.